Hello, my name is Laura Wiggs, and I'm going to be talking today about hurricane preparedness. Actually, what I want to talk about first is what you should do every year in case of an emergency, disaster preparedness. And we've experienced a few of these in the greater Houston area recently, with having also not just hurricanes, but also requests for a shelter in place. So because of that, one of the first things that you should do every year, if you have a disability or you live with someone who has a disability or a care provider for someone with a disability, is to register for 211. In the state of Texas, you have to do this annually. The state of Texas program is called the STEER program, which stands for the State of Texas Emergency Assistance Registry. And what this registry does, it does not provide you with any special, they'll come and rescue you first, but what it does is it alerts the local emergency officials to how many people in a given area need additional help, okay? So with that, there's several ways that you can register. One is you can call 211 and go through an interview process with them. You can also register online. They will ask you what type of a disability you have. They are will also ask you about your vision and your hearing in addition to that. If you have a provider or attendant, and do you require special equipment? Those are parts of their standardized questions. So be prepared to answer those when you hop online or when you call them. The second thing that you should do every year is make and then update your emergency kit. So your emergency kit should include water, 1 gallon of water per person for 3 days, okay? And that's in case you are required to shelter in place because of a disaster and no one can get in. You want to make sure you have ample water, and that is also in case the water supply is contaminated. From a food perspective, you also want to have 3 days worth of food. This should be non-perishable food, or food that does not need to be refrigerated. If you are going to use anything like a canned good, a can of tuna, a can of chicken, you need to also make sure that you include in that a can opener that is not electric in case we are without electricity or power. You should also have a dust mask in case the air quality is poor. And we've experienced this recently with a couple of the shelter in places where there was concern about the air quality. You should also have personal sanitation bags so that it keeps you free of potentially contaminating your food supply, water supply, etc. That should include wet wipes, garbage bags for disposal, and make sure you have ample amount of hand sanitizer. You should also include a flashlight, a basic first aid kit, a whistle, so that you can use that to blow and get help, signal for help if you need that. Batteries, you want to make sure you have plenty of batteries for your flashlight, also battery or a hand crank powered radio. Solar works as well. You should also have a battery or hand crank cell phone charger. And remember your pets, especially your service animals. So you need to have adequate food, water, and supplies for your pet or service animal for 3 days as well. From a medication standpoint, this would not be immediately right in your emergency kit, but if there is an emergency that is being called, you need to make sure that you have adequate medications for that. So you should have enough medications for at least a week, and this is specifically if there is a hurricane with the possibility of significant flooding, okay? You need to have your prescription information in a waterproof bag, okay? So you can use any of those little waterproof, gallon bags, half bags, even medications, and your prescriptions need to go into those. So the next thing you need to do is make the decision. Do you stay or do you go? Obviously, if there is the local government saying you have to shelter in place, then you do have to shelter in place. Besides that, from a hurricane perspective, again, listen to your local officials. Are they telling you that you are in an area where you need to evacuate? Okay. If you decide to leave, make sure that you allow for extra time. Do not try and make that a last-minute decision, as the roads will be very congested. We experienced this several years back with traffic jams as the bulk of Houston was trying to evacuate. And you need to make sure, most importantly, that you have a plan in place for either decision. If you stay, you have a good plan in place. If you go, you have a good plan in place. Part of that planning is around your medical supplies. You need to have at least a week worth of all medical supplies, whether you stay or whether you go. And that includes catheters, ostomy supplies, wound supplies, briefs, all of your respiratory equipment, okay? Remember, wherever it is that you have to evacuate to, they may not have those supplies. And if you are staying, you may not be able to get those additional supplies, depending upon how severe the damage is in your area. If you do have to evacuate, you want to place all of your remaining medical supplies as high off the floor as possible so that they are not damaged by flooding. Highly recommend that you place as many items as possible in plastic bags that are sealed or in watertight plastic bins. Okay, this will help then keep those supplies, so when you come back, if you had a 30-day supply of briefs, you still have that additional 20 days. You want to make sure you have your emergency documents with you. Again, they need to be in a waterproof bag. Your documents should include your medical records, not the whole big stack, but your portable healthcare record, okay, that goes over very quickly your diagnoses, medications you're on, physicians. You should also have a list of your medical providers, including vendors for your equipment and supplies. This becomes a very big issue after a large natural disaster, okay? So make sure that you have that information so you can call and say, "Oops, my wheelchair was damaged in the flooding. Can you help me?" Okay? Make sure you also have your insurance card or your Medicare, Medicaid card. That has to go with you. You want to take your basic bank information with you. You need your passport, license, or ID card. You want to make sure that you think about some of the other things that you need to do just in case. So prepare, if you have a vehicle, fill the tank up, okay? Because you may not be able to get, we may not be able to get gas immediately after a natural disaster. You want to have some cash on hand in case power is lost and we don't have access to ATMs. If you have a generator, this is something that you want to make sure that you check for safety on a regular basis, so that should the power go out and you are potentially ventilator dependent and you need to have that electricity, or heat sensitive and you need to have your power on, that generator is going to work. So check it for safety, and with that, make sure you know how to use it so that you don't suffer any consequences with carbon monoxide poisoning, okay? You want to make sure that your support system or network is all on the same plan, okay? That you guys have already established an emergency plan. You have a network. That is the plan that's going to be in place, how frequently you're going to check in with each other, etc. So make sure that you have all of that already in place before a disaster hits. Now, if you are a power mobility user, you have several things to think about. You need to have a manual chair as backup, just in case the power chair or scooter is damaged, okay? You want to remember to take your cushion with you. If you do take your power chair, make sure that you are also taking your charger and your battery, if at all possible. And I understand that sometimes in flooding that is not a possibility, but if you do have that as an option, make sure that you are taking that charger and battery. Move your backup battery as high as possible up off of the floor so that it does not become damaged if there is in fact flooding. Again, plastic bag or bin that is watertight is the way to go with that. If you require a special bed because of skin issues, you want to make sure that that is something you consider in your plan of whether you stay or you go, okay? Most places are not going to have a special mattress available, okay, especially in the shelters. So think about if you have to evacuate, what could you do to work around that? Could you use an air mattress? Do you have a support system that can help turn you every couple of hours? Okay, so those would be some of the things to think about and make sure that you're planning for. If you have communication limitations, you should have a laminated personal communication board as a backup, okay? And that should also then stay in your emergency care kit. Regarding attendant care, if you're an individual who lives alone and relies on attendant care, you should not assume that your attendant will be able to make it to your home during a disaster. Okay, so again, this needs to be part of your plan. Plan ahead and make sure that you are going to be able to have assistance somehow through your support system, or that you're going to go somewhere where you can have assistance when you need it. You want to have absolutely good communication with your support system during this time. Stay in contact with them, plan on how frequently you will be checking in, advocate for yourself and your needs, okay? Remember that the shelters are fantastic, and in a pinch, it's better than not having any place at all to stay. Keep in mind, typically you only have cots at best to stay on, okay? So think about what you might need from that standpoint. And your smaller shelters will not have accessible bathrooms or showers. So while we live on the Gulf Coast and hurricanes are typically what we think of when we say hurricane preparedness, and we absolutely want to be prepared for that, a little bit of, in general, emergency planning and preparedness really can make a difference and can prevent a lot of problems on the back end for you in case you are caught in one of those situations. Thank you.